Hi everyone. I wanted to make a separate presentation on order of draw. I see order of draw as being a big issue. It's very important for phlebotomy, anyone drawing or collecting blood from a patient. So it is also a very difficult task for a lot of phlebotomists to learn the order of draw and the importance of it and why it's so important and all the other nuances that go along with what additives are in each tube, why we order them why we draw them in the order that we do. So I want to do a small presentation. So this is something you guys can look back over and over again, and we'll have lots of time and lots of ways. And as you go through your phlebotomy program and you move on to clinicals, you will understand how practice, going over things repeatedly, really helps embed it in your mind and not only memorize the order of draw, but to also fully understand the importance of order and draw and why we do it. So why is it so important that we draw tubes in a certain order? Okay, first and foremost, there can be cross-contamination. So as we go through these slides and as you go through class, you'll start to learn all the additives that are in the tubes and what those additives do. And then you can start understanding that if one additive gets into another tube, it can lead to invalid test results. It can lead to misdiagnosis of a patient, because as you go through your phlebotomy class, you'll start to learn that doctors use our lab results along with other diagnostic tests such as x-rays and MRIs, along with physical and history, to be able to diagnose, monitor, and treat our patients. So if we're giving them results that have been, that results that are not totally valid due to crossover contamination, and we'll get deeper into this as the slide goes on, then we can put out false test results. And if we put out false test results, they could misdiagnose the patient, which could lead to incorrect treatment, which could be patients getting things that they don't need, or patients not getting things that they do need, which then in turn could even, at the worst case, lead to death or disability. So also later on, I'm going to talk about the flower picture that you're going to find multiple times in the paperwork that you have online, in your lab manual, in multiple places that you can use as a tool to help you start to memorize the order of draw. And if you'll look at the picture that's here on the screen, this is a really good representation of that order of draw, because if you see those first two larger tubes over to your far left-hand side, those are blood culture tubes, okay? And then the next tube is another yellow top tube that you can use for blood cultures. Now, honestly, you probably won't see as many of those yellow top tubes in blood cultures, depending on where you work. Typically, those bigger tubes will be the ones that you will see. But I'm going to be honest with you, depending on where you work, there are multiple. And in lab class, I'll show you just a small fraction of the different types and sizes and shapes of blood culture tubes that are out there at your disposal to use depending on where you work. But when we refer to this flower picture that helps you learn the order of draw, the first thing in that flower picture is that sun up in the sky that shines down on the flower. And the sun, of course, is yellow. And so we refer to that yellow sun in the mode of this first normal size tube you see here that is yellow, because that is a tube used in blood culture collection. So the blood cultures are usually, just to make it simplified, in the picture usually referred to as either a yellow top tube or blood cultures. So then there's some other blue top tubes there. The light blue tube is the one we're going to talk about next. That's the one you're going to learn most of in your phlebotomy classes. And then there's different variations of red. The one next to the red one, which is a yellow, and we'll go over all this in lab. This is just a starter point for you that you can look back on, is what we refer to as an SST tube, which is a serum separator tube. where you see that gel substance, which is an additive. Anything that's placed in the tube is an additive. And you'll see that gel concentrated down there at the bottom on that yellow tube that's right next to the red and in between the red and the green. That serum separator tube can be called a tiger top tube because a lot of times it may be black and red. This particular one, probably if you were able to look down on that tube into the center, it would be red, and so you have the gold and the red, or a black and red. There's different names for it, and we'll go through it. But the dead giveaway that this is a serum separator tube, which is drawn after your red top tube, is the fact that it has that gel down in the bottom of it. Then, of course, green, purple, that pink or variation of a purple lavender is exactly the same. A pink tube is exactly the same as a purple top tube, except typically they use those purple top tubes almost exclusively in blood bank. We go down to that gray top tube, and the gray top tube is the last one that we're going to talk about. There are multiple other tubes out there. I just try to limit these tubes, and the flower picture and what we go through on the slide is going to be limited to the tubes that you are the most often going to use as a phlebotomist in the order in which they are drawn. But remember, the most important part of this for you is that we want to draw these in the proper order to avoid cross-contamination of one additive going into another tube, which could possibly lead to invalid test results, which could lead to misdiagnosis, which then could lead to incorrect treatment. Okay, so order of draw. You know, this just refers to the order in which the blood is collected, right? When you're ordering, obviously, when you're collecting more than one tube, right? And we do this mainly the system that we want to use most often, because it's the safest and easiest to use when drawing multiple tubes, is the evacuated tube system. And if you'll notice this picture we have here on this slide, there's a gentleman that is seated with the tourniquet tied around his arm, and there is a phlebotomist or a phlebotomy student in front of him. Of course, she's wearing her gloves, and in her left hand, the hand further away from the front of the slide, she has in her hand an evacuated tube system. Now, we'll go over this in lab class and in other presentations, but what's included in the evacuated tube system, and you can see this, of course, is a needle that is attached to what looks like a clear plastic tube, and that's your holder. That's your evacuated tube holder, okay? And inside that holder, when you put that needle on there, there's a needle on one end that you see sticking out that goes into your patient's vein. On the other end of that needle, inside that clear plastic evacuation holder, is a sheathed needle. That sheathed needle is the needle that when you press your tube, whatever color top tube you happen to be drawing at that time, into that holder, it presses onto that needle punctures that tube, and that tube is evacuated. Now what that means is that tube has had all the air drawn out of it. So the minute that sheath needle that's on the inside of that tube, when you press it on there, it breaks that seal and air starts to flow in, and that's what pulls the blood into the tube and starts automatically filling the tube up. So then what you do is when your tube is full, and it depends on what type of tube is, whether it needs to be 100% full, but those tubes are set that if they are working properly, they will draw the set amount if it's supposed to draw to 100%. There's other tubes that you only have to fill them halfway full, and we'll go through all that. But you put your tube on there, draw the blood in, then you can remove that tube while being able to leave that one needle still in that patient's arm, pick up another tube, place it on there, and you can go forth. You can draw 2, 3, 4, 5 tubes while only having to stick that patient one time. So this is a very safe and effective system to draw multiple tubes, but we have to make sure that as we're using this system, we are drawing these tubes in the correct order. We also have to make sure one of the most if not the most important job of a phlebotomist, and I call it the most important job of a phlebotomist, to properly ID your patient. You want to make sure that when that rec is given to you or it prints out of a printer and you have that rec that tells you to draw a CBC and an electrolyte panel and a lipid panel or whatever it may tell you that that doctor has ordered on that patient, that you make sure that the patient you're drawing that blood on has been properly ID'd and you are drawing the blood on the correct patient. You also want to make sure that you identify yourself, who you are, where you're from, and what you're there for. And you always want to make sure that you are executing the best care of your patient. We are in the customer service business, and we want to make sure that our patients are comfortable, that they've been, if it's in an outpatient situation, that they are comfortable in the chair that you have seated them in, that you have made it to where they're safe, because sometimes patients are scared of blood draws. They may pass out or lose consciousness on you. You want to make sure that you use the proper phlebotomy drawing chair and make sure you lock the patient in so if they were to lose consciousness, they wouldn't fall. You want to make sure that you're polite, caring, and kind to your patient. But first, you must properly ID your patient. So in moving from properly IDing your patient, which is something we will go through over and over and over again, the proper way to ID your patient, ID yourself, and perform your medical interview, which would include whether your patient is fasting or not. So we'll be going over that in lab over and over again, okay? But to stick on the realm of order of draw, so not just when you're drawing blood with a evacuated tube system is order of draw important. Okay, when you're using what we saw from our previous slide, what I talked about, when you're using that evacuated tube system, you want to make sure that you perform order of draw. But anytime you are placing blood into blood tubes, you want to make sure that you do it in the proper order of draw. And if you'll see this photo here, and we will again go over this in other slides and in our lab, you will see another one of those plastic tube holders right there. And if you'll notice, if you look closely inside that plastic tube holder that's kind of over to the right part of your screen, right near what we see as a red top tube, you will see that gray sheathing that is on that internal needle, and that is the needle that punctures that evacuated tube, and then it draws that blood into that tube. Okay, this is connected to a winged infusion set or a butterfly. So we can use that winged infusion set or butterfly to draw blood from our patients, but in certain situations we can still use this evacuated tube system and be able to draw these just like we saw in the previous system. But you can also, there's a way to draw blood in syringe or syringes and then be able to take that blood from the syringe and use a transfer holder, which looks similar to this, but it is a way for you to connect the holder to the syringe, and then it turns it into an evacuated tube system so that you then can push your tubes onto the inner needle of the holder and be able to draw the blood from your syringe into the evacuated tubes. And that's the way you want to do it for multiple reasons. One, you never want to take a needle and put it into a tube because you could accidentally miss and then stick yourself. And there are other things that we will go over, safety equipment that's out there that you can use if you were to have to do that. But this is the safest way to do it, and it ensures that with those Vacutainer tubes, like I told you before, they're set to draw a certain amount of blood. So with certain tubes, like your light blue top tube, you need to draw those things at 100%. The ratio needs to be correct between anticoagulant and blood. So you want to make sure that when you push it onto the Vacutainer system, you wait until it stops drawing any blood before you switch it out into another tube. But the order of draw needs to be done whether you're drawing directly out of a patient's vein with a single needle with an evacuated tube system, whether you're using a syringe and you're using a transfer holder to transfer it from the syringe to the tubes, or if you're using a butterfly needle. So, in the order of draw, the first tubes that need to be drawn in the order of draw, like we saw in that very first picture on our presentation, is our blood cultures, okay? So, in the order of sterile first, right? We're worried about sterile first. Because the very first tube we want to draw is those blood cultures, because we want to make sure that the sterile technique is spot on. And so when you take a needle out and you move it from tube to tube, you're exposing it to more of the germs that are just out in the natural flying around in the atmosphere in your air, right? So we want to draw these first. So that way we have the best sterile technique possible. And then, like I talked about earlier, there's different types of blood culture tubes and bottles. It's best to look at the label. There's aerobic and anaerobic tubes now, or blood culture containers. Now, what we like to do first is the aerobic. We like to draw those first because those are looking for bacteria that can grow in the presence of oxygen. Okay, so we'll draw one that aerobic and anaerobic. We want to draw one that the bacteria is looking for an environment. It grows in an environment that has oxygen. And the reason we draw it first is in case there's any air in any of the lines or any of the tubes or any of the needles, and some air gets into that blood culture tube, it's not going to make a difference because that's the aerobic one anyway, and it is looking for bacteria that is okay with an oxygen environment. So then the next one that we draw would be the anaerobic bottle, because it's looking for bacteria that grows in the absence of oxygen. So that's the order in which you want to draw those, right? And which bottle is which will be labeled on the bottle, and so it will help you out in that area. So what do we see in these blood culture bottles? You see there's quite a bit of liquid in there. So if you'll notice in the picture to your far left, there's an orange, it looks like a blue color, teal blue color, and a yellow color. Okay, and there's different additives in each one of these tubes. Some may be aerobic, some may be anaerobic. The thing you're looking at is if you look down at the bottom, there's that little white layer down at the bottom. That's there across the bottom so that it helps see growth. If there's some growth there, we can kind of see that, okay? And then above that, there's media in these blood culture bottles, okay? This media is there to provide the best environment possible for bacteria to grow. We want to give this bacteria all the nutrients that it needs, so if it is there, it will grow, okay? That's why you store these blood culture bottles in the incubator, because we want them at room temperature. We want them at body temperature, right? Because if that bacteria is growing inside your body, okay, we want to set it up so that it will, if it is there, we want it to grow so we'll know what it is. And the way we do that is by setting it up with its best environment. We give it some really good media or some type of broth so it has all the nutritions it needs to grow that would have been getting from inside your body. We put it at a temperature it likes, at your temperature of your body, okay? Now, so we know that it has across the bottom, that's there so it can see the growth. We know there's media in there, right? There's an anticoagulant in there, which is something that's in that tube to prevent that blood from clotting. And sometimes there's other different kinds of chemicals inside those blood culture that inhibits or stops the normal breakdown of bacteria, because we know that our body likes to try to break down that bacteria and get rid of it, right? And so a lot of times they'll put stuff in these blood culture bottles to kind of stop that, because we want whatever's there to be there so we can identify it and then find out what the best treatment is for the patient, right? So just remember, main thing is they're drawn first, because they're sterile, right? We want to try to keep them as sterile and prevent contamination, okay? And then we need to worry about aseptic technique. We will go over that in lab, and you will understand what the aseptic technique is. And then we understand that there's different things in that tube, from media and broths to anticoagulants to chemicals, right? And if you'll notice in the picture over to your right, over to the right side, there's two bottles there, right? Because usually there's an aerobic and an anaerobic. We talked about this, but if you'll look, one has the blood already in it, which the ones to your left already have blood in them, and the one over to your right has blood already in it in that one picture, and the one over to the left does not. And you can see that brown straw-colored liquid that is in that blood culture tube. That is that media that's in there to help facilitate the growth of whatever bacteria may be there. So we draw our blood cultures first, right? And in our flower picture, it's the sun, right? Because of the yellow. So the next tube that we talk about is the light blue top tube, right? That's our coagulation tube. That's what we call our coag tube. And just remember, when we draw our blood culture bottles, those are delivered to the microbiology section of the laboratory, okay? When we draw a blue top tube, a coagulation tube, that tube is delivered to the hematology department of the lab. Now the light blue, it's collected first because other additives in other tubes can affect coagulation testing. Okay, because what we're looking for, and it is extremely important that when you're drawing this light blue top tube, it is 100% full. Okay, and we'll go over about the ratio, but it has to be 100% full. You always want to draw it first because you don't want a different additive that speeds up clotting, that anything like that getting into that tube, because then it could give us, like we talked about before, invalid results, which could then in turn lead to misdiagnosis or mistreatment and could lead to the death of our patient. So as a phlebotomist, the job you do is very important, and we want to make sure we understand order of draw and how important it is. Okay? So what are the additives? Like I told you earlier, and we'll go over this plenty of times, but anything that is added to a tube is considered an additive, okay? Now the additive in the light blue top tube is sodium citrate, which is an anticoagulant, okay? That, as we know from medical terminology, anticoagulation, right? It prevents the clotting of the blood, okay? So some things you need to remember with the blue top tube, it's like I told you, there is a strict ratio of the sodium citrate to the amount of blood that should be in the tube. We want the proper mixture of the blood to the anticoagulant. It's very, very important when you're talking about coagulation studies. So we always want to make sure that this tube is drawn properly. It's drawn first, and it is drawn 100% full, okay? So there is a caveat to this, or there's an exception to this, okay, where we do draw out of order, and it involves the light blue top, okay? So if we're drawing the light blue top, there's two reasons we would need what we refer to as a discard tube, okay? We need a discard tube for one reason. One is if you are drawing any other lab test with that blue top tube, if it's a PT and an electrolyte, a PT and a glucose, a PT and a CBC, then you must draw a discard tube first. And what is our discard tube? It is a plain glass red top tube. Okay? So if you're drawing a blue top tube and it is ordered with any other test, then we must draw a discard tube first. And that would be a red top tube, right? The other reason would be if we're drawing with a butterfly or a winged infusion set. That's just another name for a butterfly. Now the reason we would do that is because winged infusion sets or butterflies come with tubing. Now remember how I talked about how vitally and important it was that the proper amount of blood to anticoagulant ratio is spot on with this light blue top tube. There's air in that tubing. So if you draw it first, then as it goes to suck that blood into the tube, it's going to be a little bit off because it drew that air in. Okay, you have to remember it's going to draw a little bit of that air in, and I know it's not very much, but it could be off a little bit, which could have devastating effects to a patient who's having real coagulation issues. Okay, so we would need, if you're drawing it with a butterfly or a winged infusion set, you would need to use a discard tube. If it is ordered with any other test, you need to use a discard tube, and our discard tube is a plain red top tube. Now, what are some of the tests that we draw in a blue top tube or light blue top tube? PTs, PTTs, INRs, and a multitude of other coagulation studies. Okay, so moving on, order of draw. The next tube that we draw, and you'll see this from the flowers, our red top tube. Plain glass red top tubes. And we'll go into the fact that how long it takes a plain glass red top tube to clot. Now, you will not see, normally plain red tops are used for chemistry studies. But most places you go to work, that's really not the tube they use for that. And the reason being is, as you will go through the program, you will hear the word turnaround time. We're worried about turnaround time. We need to get on the floor. We need to ID our patients properly. We need to identify ourselves, what we're there for. We need to make sure we do good customer service with our patients and take good care of them. We need to label our tubes properly and transport our tubes properly. It takes time. We do not need to add another hour or 30 minutes onto our time waiting on a tube to clot. With the red top tube, there's nothing in it. It's plain. There are no additives in a plain glass red top tube. So without an anticoagulant in it, then we'll have to wait on it to clot before we can spin it down and be able to run our chemistry test on it. No one wants to wait that long. It increases our turnaround time, so you will rarely see this used as for a chemistry test. Not to say that it couldn't be, because it can, and you will see mostly all profiles and panels in chemistries can be drawn in a red, green, or SST tube. Okay, the next one you'll see is a red top tube, but it's plastic. Okay, and it clots a little bit faster because that plastic in that tube increases the friction inside that tube, so it speeds up the clotting time a little bit. Then you'll have, and you'll see it in the flower, so you have the red, and then that middle section of the flower looks kind of like multiple colors, like a darker color red and stuff. These are your SST tubes, okay? And like I told you, they can be referred to as a tiger top tube, a speckle top tube. And I'll show you in lab all the multiple ways you will see this tube, okay? But the main thing that you're looking for in an SST tube, which is a serum separator tube, is that gel that's down in the bottom. And it can be a dark colored, or if you'll see this tube here that has the yellow top on it and then the red in the center, which is considered an SST tube, it has already been spun down, and you'll notice there's some red cells, and then there's this clear looking area, and then some darker amber serum. That clear looking area is the gel. Sometimes the gel is a darker yellowish amber color. Sometimes it's clear. That's an SST tube. But in the order of draw, it's blood cultures, light blue top tube, red top tube, and then any of your SST tubes or speckled or tiger colored tubes. Now, again, they're used, both the red and the SST tubes are typically used for chemistry tests, okay? Now, the deal is, with turnaround time, those SST tubes usually have another additive in it, because remember, anything that's in the tube is an additive. So that gel is an additive that's put in the SST tube, and something else that's in there is something called silica. And you'll see in the plastic red top tubes and the SST tubes, it looks like the inside of them is coated with like this white powder. That white powder is silica, which is an additive. And you'll see it in some plastic red top tubes, and you'll see it in SST tubes. Silica is specifically to increase the clotting time. And you go from 30 minutes to an hour, which is how long it takes for a red top tube to clot, to 5 to 15 minutes in an SST or some tubes with silica in it. So we can see where that increases our turnaround time. We can get that tube clotted faster. We can get it spun down, because you can never spin down the tube until it is properly clotted. Okay, so you have to wait. So that can speed up our time. So we do see that used with some chemistry test, but that is not the tube you see used most often any longer. And remember, the discard tube is a plain glass red top tube. And we remember from our previous slide what we use that discard tube for. Okay, so after that, and you'll see at the end our flower slide. So after we talk about our sun in the sky, which is yellow, which is our blood cultures that we always draw first, then our raindrops coming out of the sky, which is our light blue, because the rain needs to give our flower water or to grow, right? So that's our light blue top that you draw next. And remember, the only time we draw out of order is the example I provided when we need to use a discard tube. So after the light blue, then we have our red, then we have our SST, right? Then we have our stem of our flower, which is green. So the next tube in the order of draw is the green top tube. Now with the green top tube, it has an anticoagulant in it. That's the additive in that tube. And remember, anything that's put in the tube is an additive, whether it is gel, whether it's silica, whether it's any of the multiple anticoagulants that are out there, whether it's some type of preservative or chemical, anything that is put into a tube is an additive. In the green top tube, we have heparin. There's sodium heparin, lithium heparin, and ammonia heparin. These are all anticoagulants, and they are to prevent the blood from clotting. So if the blood does not have to clot, then we can spin it down immediately, which increases our turnaround time. Green is used most often for chemistry studies, okay? Now remember, every profile and panel can be drawn, chemistry profile and panel, whether it's lipid or electrolyte or chem panel, in a red, green, or SST. There's only one panel that we cannot use the green top for, and that's the thyroid panel, okay? So just keep that in mind, and we'll go over that in other slides and things like that, so we know that's going to be a test question, right? So we got our green top tube, which is used for chemistry studies, right? It has an additive in it, which is an anticoagulant, which is heparin, and there's ammonia, lithium, and sodium heparin. Now remember, that's going to be on the label of your tube, and you want to know that before you get started, because if you're doing a chemistry profile that has sodium in it, you would not want to use the heparin sodium, because it will falsely elevate our sodium, right? Because if there's sodium already in the tube and we're testing for sodium, we don't want that in there, because it'll give us a falsely elevated sodium, right? And we'll have invalid test results. Same thing, if your chemistry panel has an ammonia on there, you would not want to use the ammonia heparin for the same reason. And if you're doing a lithium test, you would never want to use the lithium heparin for, again, the same reason. They would all elevate, right? Which would give us invalid test results. So the next one in order is purple. Okay, our purple top tube also has an additive in it, which is EDTA, right? And EDTA is an anticoagulant, prevents the blood from clotting. It also helps with cell morphology. It helps maintain that cell morphology, so that when they're looking at those cells under the microscope, they'll be able to tell the difference in the cells. So that's another little added thing with that EDTA. And so remember, our green top tube is for chemistry profile, so we're going to take it to the chemistry department in the lab. Our purple top tube is mainly for our hematology studies like CBCs, hemoglobins, hematocrits, platelets. And it would be taken to the hematology section of our lab. But it can also be used for a hemoglobin A1C testing, which has to do with your glucose in your patient, and we'll go over that test. But it's also done in that purple top test, but that would be done in chemistry. And then at the very end, we have the gray top tube. Okay, the gray top tube can be used for a couple of other tests like lactate and ethanol testing and things of that nature. But mainly what we see it used for is for glucose testing. When you're doing fasting glucose, or if you're doing glucose, some type of glucose studies, whether it's when women do their gestational, if they're checking for gestational diabetes and they come in to have testing done. Because the purple top tube not only has it has two different kinds of additives in it, okay? First, it has sodium fluoride. Sodium fluoride is what I refer to as a preservative. It preserves that glucose. So the gray top tube is the best top tube to draw if you're doing glucose, okay? Because it has something in there, it preserves that glucose, so that if that tube sits there for a little bit, you're going to make sure you get that same accurate result in that glucose, because it stops glycolysis. So those cells are in there, they still want to stay alive, right? So they use that glucose as energy, and that sodium fluoride stops that glycolysis. It also prevents bacteria growth, same way, because the bacteria doesn't have anything to grow off on, so that won't grow. And then it has potassium oxalate. So it has two additives, right? We talked about the sodium fluoride. It also has potassium oxalate, which is an anticoagulant, and it prevents clotting by binding the calcium, which a lot of them bind the calcium, but that's the way that one works to prevent it from clotting. So you can spin it down and do your testing immediately, right? So we went through it, right? Blood cultures, yellow, light blue, the coag studies, the raindrops coming out of the sky, right? Then our flower, red petals, the inner is your SST, right? The green stem, then the purple container, the gray rocks, right? So that's how that picture works to help you remember the order of draw, because it's being so important. Here's a copy of that picture. You'll have that picture in other places, okay? So to finish up, remember, you guys are professionals, right? You're working towards being a professional, and you are a vital and important part of the healthcare team. And remember, the important parts are making sure that you properly ID your patient, that you identify yourself and why you're there. Remember, good customer service, that you have proper collection and transportation of your specimens, including the order of draw. So we'll see you on the next lesson, and you guys can go over this multiple times, because this will be an important part of the things that you need to learn. Have a great day.